One of the tests is called renal clearance. How much waste actually gets removed in 1 minute? So they will do tests on the glomerular filtration rate. Then the test that they'll do, they'll see how much of the waste will be present or removed. And then we have to do this by collecting blood and urine, because that tells us how much waste is in the blood. For example, when you have blood drawn, one of the tests they can do is bond the blood, urea, nitrogen. And that tests the amount of urea and nitrogen in the blood. If that's elevated, then that means there's the possibility that the kidney's not functioning to remove that waste from the blood, that it's staying in the blood. When we look at this filtration rate that gets tested, we're looking to assess the kidney disease. So we need some type of substance that can be not affected by the kidneys at all. So what'll happen, they'll inject you with something called inulin. Basically, the kidneys do nothing with it. All right, or it should just be straight through. You get injected, and then they begin to measure if what you got injected with is showing up in your urine. So it's kind of cool. Creatinine is also used, but that's it does have a higher rate of error, mainly because your muscles can use that, can use the creatinine.
Right. When you have like a kidney disease or kidney infection, does that mean that you're always going to be like prone to like a blood infection? Because
No. A simple kidney infection can happen for lots of reasons, and usually the antibiotic will cure it and you're done. Okay. Now, if it continues to happen, then chances are they're going to move into more testing of the kidneys. Mm-hmm.
Is that because you don't get rid of the electrolytes?
The biggest one that you're not getting rid of enough, well, actually, what happens is when the body is not metabolizing and handling calcium correctly, calcium begins to deposit in soft tissues. So what'll happen is calcium will begin to deposit in these tissues, and then as it tries to get rid of it, it's going to try to move it through the kidneys, okay? And so it'll make its way into this renal pelvis area, where now it enters into that ureter. And depending on the size of it, determines the pain and that sort of thing that you're going to have. If you're prone to kidney stones, you're probably passing small ones all the time and you don't even know it. Okay? It's when they become a larger, a size that's going to actually be detected by that ureter that it becomes the issue. Yeah. So, yeah, just depending on how prone you are to it. So once we get that formation of the urine and we've made it into the area of the renal pelvis, well, the next thing we get to do, we get to begin to move that fluid out and get it ready to be excreted from the body. So, our ureters, it is a muscular tube, all right? Urine gets to enter, and it passes by way of peristalsis. Basically, the constriction, relaxation, constriction, relaxation, constriction, relaxation of those ureters all the way down. Now, remember where your kidneys are, okay? And then where your bladder is, okay? That's quite a bit of distance for this action to be occurring. One of the reasons it hurts so bad with kidney stone. Okay, and so it passes by this constriction, relaxation to the bladder. The bladder itself has a muscular portion called the detrusor muscle, and it's got 3 layers of smooth muscle. We control that. Hold on to that thought, because if you're like thinking, you get the big gulp and you drink it and you're driving down the road and you're like, honey, maybe we should stop at the next rest stop, or maybe we should go by the next exit. Okay. Honey, that was the exit. Oh, we'll get the next one. And then you're like, honey, you need to hit that next exit, okay? Or we're going to have a problem, all right? You're controlling that, all right? Now, it can get to the point where, all right, we get to the next exit. Hello, I'm talking over here. Oh, we'll do that. Next thing you know, oh, well, we don't need an exit no more. We need to clean up on aisle 3. Okay, so, you know, your body can override it. Hold on to those thoughts, because at this point, you're each thinking the bladder, right? Your urethra. It's the urethra. Because the bladder is really just a storage area, all right? And the makeup of it, all right, you're going to have 3 little holes. You're going to have the 2 where the ureters enter, the 3rd for the urethra. That's the area known as the trigone, okay? Now, do you guys remember the transitional epithelial tissue that you might have looked at in part 1, where the transitional means it gets to push out and then lay back down, because that's what the bladder is going to do, okay? The bladder can fill up and expand, and it looks like the cells are one structure. Once you go urinate, the bladder goes back flat, and it becomes what looks like a different structure. Yes. And that's why it can be painful, that sort of thing. You don't want the urine buildup to get to that point, though, okay? You know, so we have a lining of mucosa in the bladder, mainly because urine is acidic. pH of blood should be roughly 7.4. Urine should be somewhere around 6.5, I think. Okay, why? It has an opening that is exposed to the exterior environment, and bacteria can enter. And you don't want to give an environment that bacteria like. It being acidic, chances are the majority of the bacteria would be killed. So it's kind of cool. Right. If that acidity, if we change the pH of the bladder, that's usually when we're going to get an infection. Now, the structure of this bladder, basically having that transitional epithelium, it allows for the expansion. depending upon, the size, okay, usually at about 500 milliliters, you're thinking, I've got to go, okay? I got to go. Max, roughly between 700 to 800 milliliters. Some people can have more, some people can have less. But this is sort of what the bladder is going to look like. This is that area of the trigone where the ureters enter, and then we have the urethra. Now, when we begin to think about this control of the urine, okay, how is it that we're all just not walking around in diapers, okay? On the urethra, we have two sphincters, the internal and the external. The internal sphincter is smooth muscle. We don't control that. The external is skeletal. This is the one that you train. Do any of y'all remember going through the potty training? You do? No. Okay. Mom and dad are doing this number. No. Okay, and come on, let's go. They're training you in the way to get you to control this one.
Wasn't that like long time ago? That give away like your position or whatever, your baby. Urine, because like animals probably study.
Yeah.
Predator study your urine. Like, stay here. That's what they stand for. We need to come here and get done.
Oh yeah. I would think just like, like early man and stuff like that, their other senses were probably highly developed, like smell and so forth. So it probably did. Because if I'm not mistaken, in early man, that was one of the ways that they protected their clan or whatever. Okay, they actually urinated around the area. Yeah. Now here's what happens for us to have to go to the bathroom. As we begin to have the filling of the bladder, notice that we have innervation. We have innervation with our parasympathetic. We've got innervation that's going to be able to send information by way of the spinal cord to the brain. The response is going to come back by way of the somatic motor system, because that control is for the skeletal muscle, and soma being the body. So as the bladder fills up, we get the information by way of the nerve fibers. Information moves to the brain. The signal will come back to release that skeletal muscle, and you'll urinate to relax it.
If you how would you know?
You don't. That's why they'll be on a bag for the rest of their life. Yeah. So this is called the micturition reflex. The actual act of going to urinate is micturition. So if you hear a doctor say, how many times did they micturate today? Doctors, the urinary doctors, yeah. They're going to be asking how many times they go to the bathroom today. Yeah. You guys are officially finished with me until next Thursday. Any questions on anything? Yay!